by temporal artery biopsy. And why do you give high doses of steroid in these cases? To prevent blindness in the other eye. The non-arthritic cases are the most common in rest of the cases, but there is no treatment for them. The toxic optic nerve neuropathy is the other cause of acute visual loss. What are the substances which cause toxic optic neuropathy? Ethambutol, methyl alcohol or methanol, ethylene glycol or antifreeze, and carbon monoxide. What are the clinical features? Acute visual loss with bilateral optic disc swelling and central or secocentral scotomas. The toxic optic neuropathy can also cause gradual visual loss without optic disc swelling. So what are the substances that cause insidious visual loss? Amongst the cardiac drugs, these are the few substances that cause insidious visual loss. Imidrone digitalis, amongst the antibiotics ciprofloxacin, the TB drugs INH and streptomycin, and sulfur drugs. The deficiency states of starvation, malabsorption, and alcoholism can also cause the insidious visual loss and toxic optic nerve neuropathy. What should be checked in a patient with bilateral scotomas and optic pallor?